The Palo Alto Medical Foundation, part of the Sutter Health Network, cares for 1 million patients a year on the peninsula, from San Francisco to San Jose, into the East Bay, and west to Santa Cruz, California. The Variation Reduction Program is an initiative aimed at improving quality by identifying variations in patient care as well as reducing costs. Back in 2009, events were unfolding rapidly.
We had the healthcare reform on the front page every day. We had the economy in bad shape, and we had patients coming in every day to every doctor saying, I just can't afford this. I have to do this. I can't do that test. That trifecta really said to our docs, we got to do something, and we can't wait for the insurance companies to do this.
The initial approach to reducing costs was to develop new standards for the most common and routine medical tests. Since the program began in 2008, it has generated over $14 million in savings, and it has now expanded throughout the Foundation's spectrum of services.
It's about trying to provide affordability that can then be translated into improved access for more people for the same amount of spending. That is improving quality at the same time. And I think, this is the way that health reform works.
We need to be focusing on a best practice. I think that it's a mindset change for the doctors of getting away from this is the way I've always done it, this is the way I was taught, to trying to stay current on what the modern way of approaching issues would be.
So our clinical variation reduction program is all about improving the quality of service and care that we're providing to our patients.
The real critical piece is getting physicians engaged in looking at it and doing something with it. And that's really, I think, the value that Dr. Shapiro has brought to this whole process. He's taught us how to do that.
Dr. Lawrence Shapiro, a pulmonologist by training, spearheaded the variation reduction effort. He understood that for change to really take root, physicians had to be a part of the process from the very beginning.
My pitch to the docs is, we're doing this because we're a profession. And as a profession, we have a responsibility to our patients. We understand that there is sometimes warranted variation. What we try to do is take out that warranted variation and then get down to the core of what's unwarranted.
In the course of their study, Dr. Shapiro and his team found variations across the board. One example was the variation in the time interval between screening colonoscopies in low-risk patients.
And so initially when they brought us the data, we thought there would be no variation because the national standards show that if you have a polyp, you come back in 5 years, and if you don't have a polyp, you come back in 10 years if you're an average risk patient. And what we found was that there was a huge variation among the physicians. When we talked to specific physicians about why there was this kind of variation, we found that it was subjective, some of it was systems errors, and all of it could really be corrected.
The Foundation treats 66,000 patients yearly for hypertension. The Variation Reduction Team found it's the most common chronic condition for which patients see their physicians.
So we got 40 representatives from the 500 primary care docs and sat them down and said, well, how do you handle this? How do you handle hypertension? And we realized that there was tremendous variation even within how do you take the blood pressure? How do you have your medical assistant take the blood pressure? So we had to standardize some of these very basic things. It was really interesting. In one of our pilot sites, we actually reduced the incidence of hypertension because we just took the blood pressure correctly.
We choose the standard based on the best knowledge of the professionals that we have involved, and we develop a standard, and then we test it. And we follow our balance measures, which are the test to make sure we're not causing harm. We went into medicine because we care about patients, we care about what we do, and we want to preserve the art, but we also want to work towards having a tighter and more rigorous science into what we do.
Healthcare is all about science and art. So there's the science of what we should do, and then there's the art or the service of how we do it. In my feeling is if you eliminate the unnecessary steps, you free up more time for the necessary steps.
It's an easy metaphor to think about, especially as we sit here in Silicon Valley, is this is a startup. Okay? And when you talk about startups, you think that you're going to lose money for a while. Okay? But eventually you have that goal, you have that business plan that says, okay, we're going to be able to produce something that really is going to be worthwhile, and it'll make a big difference.
Hi, Sarah.
As a result of the variation reduction program, Palo Alto's physicians are convinced more than ever they are providing superior care for their patients. They've learned to balance whether the benefits of another test or procedure outweigh the possible harm that test or procedure can cause. Learn more about the Variation Reduction Program by visiting PAMF.org.
Trust. As individuals, it's a determining factor in the relationships we develop, and as consumers, it's at the core of most of our buying decisions. Certainly, trust is important in all interactions, but when it comes to our medical care, nothing is valued more than the trust you place in your healthcare provider.
Go. Okay, can you...
During an era where there is so much public scrutiny of hospitals and healthcare providers, the North Shore LIJ Health System recognizes its obligation to strengthen the public's confidence in the practice of medicine and our delivery system. That's why we developed a strategic partnership with the Institute for Healthcare Improvement, the prestigious international organization that believes everyone deserves safe and effective health care, and has been working with providers and leaders throughout the world to fulfill that promise.
Because once you're regarded as a partner with IHI, it actually catapults you into a higher league, and obviously forces you to get better, because now you're in a different kind of grouping with a lot of the other premier organizations in the United States.
As the largest integrated health system in New York and one of the largest in the nation, North Shore LIJ is working with IHI to test innovative ways to reduce incidence of sepsis.
So sepsis is a national problem. It probably is the largest source of mortality in the hospital in our country. And it's one of those problems that we need to raise awareness among healthcare workers, among patients, and among the public in general.
And we want to have all of our clinical staff